Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. And here we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Welcome to our weekly show. My name is Abby. I'm your Healthy Living NP. How are you guys doing? Hope all is well. Let's get into the show. As you can see, it says do and don'ts for visiting patients in the hospital. Okay, so let me just make this a little, put my glasses on. Please share the show. Please share the show. Nothing heavy tonight. Please share the show. Just little tips here and there. I was looking for some an article where you can talk about how to visit safety, visiting your relatives in the hospital and friends, but nothing that's going to be kind of mean spirited towards visiting your family and friends and all that too. So I saw this nice article. Let me just get my manners together here. Already, so share the show if you're first time here. This is our weekly show, and I also do Abby's daily dose during the week, where the short little videos, like 90-second videos during the week, and all that. Okay, so welcome. Please invite others. So do's and don'ts for visiting your friends and family in the hospital. Okay, so let's go to number. I'm just like no particular order here, so but let's start from there first. Okay, so what do you do? Oh, by the way, of course, my disclaimer. I'm a provider, but I'm not your provider, so please do not make any changes to your regimen without checking with your own provider. Okay, I say that all the time, and that's very important. I'll also talk about don't get your health information. You can learn about things on the internet and things like that, but whatever decisions you decide to make, that should be between you and your own doctor. Okay, don't get stuff. Somebody says don't do this, and you say, oh, I'm going to put my medications away, or I'm going to do this, I'm going to do that. Please make sure you are consulting with your own doctor, nurse practitioner, PA, and all that. Okay, again, all right, it's very important. All right. Okay, so let's start. Again, like I said, please give me a thumbs up in the meantime, because this going to be a good show. All right, please share it. Please share it. Please share it. All righty, so let's get right into the show. Okay, so do ask for permission to visit. It's important, okay? Now you're saying, why do I have to ask for permission? Because sometimes not everybody wants a visitor right away. So ask them to be candid with you. If they prefer for you not to visit, don't take it personal, by the way, okay? If they prefer for you not to visit, don't come, because sometimes you're in a hospital, you're taking, giving you medications, or you just had a procedure, you may be nauseated, sometimes you have like vomiting, diarrhea, you have so many other things, you're in uncontrollable pain, and you don't want people to come visit. You just want to relax and be there by yourself. It could be your husband, it could be your wife, it could be your mother, close relatives and all, because you just say, don't come around this time, or maybe don't come today. I just want to rest a little bit. Okay, so make sure you ask for permission first before going. All right. Number, I'll get to like, do wash your hands. So make sure when you get there, you get into place, get into the room and all that, wash your hands. Sometimes if you can wash your hands, there's hand sanitizers right there. They're all over in the hospital. As soon as you get into the hospital, put the hand sanitizer on. You get into the room, put the hand sanitizer on. So it's not just, usually when you go into the maternity room ward, you there with the babies and the mommies and all. This is not just for babies only. You make sure you wash your hands or put hand sanitizer on, okay? You put the hand sanitizer on, you do this and everything. You're doing your fingers so there's nothing in your nails and all that go all the way here. If you wash your hands, you wash your hands nicely, let the water run out, take the paper towel, wipe your hands before turning the water faucet out, okay? So make sure you wash your hands, because you don't want to infect the patient, and you also don't want to get any infection towards you too, okay? Because when you leave in the room, also wash your hands or put hand sanitizers on. Alrighty. And excuse me there. Also that you're supposed to wear a mask. You can ask them, especially this time of the year where you're getting COVID and you're having respiratory viruses that are in the air. Ask the policy when you get in there first. Do you want me to wear a mask? Do you feel comfortable if I wear a mask? Because you coming into the person's already the immune system is already impaired, so you don't want to bring anything in. So if you can wear a mask while you're there, that's fine. If you're going to take it off just to take a picture, that's fine. But ask what the policy is when you get there too. So because some places at this time of the year, the mask is mandatory too. Okay, so ask first. and put it on and follow their rules, because some places will say if you don't wear a mask, you're gonna have to get out. Because not only, especially if you're in a semi-private room, your family members in the semi-private room, you don't want to go in there and infect them or the other person, because a lot of people got so many things that's going on with them. Be mindful of that. Okay. And also to said, consider allergies and restrictions on decorations and gifts and all. Okay, so when you bring in balloons or flowers and all, some people can be like really allergic to fresh flowers and all, and you bring it in and it starts sneezing, or you bring some decorated stuff with the colors and the painting and the crayons. They could be allergic to that too. So it's important that you ask first to say, do you want me to bring something else? And some people also are allergic to latex too, and some of the balloons and all that they're made of, and some people bring plastic flowers. So just ask first if you're like, you want me to bring that? Or maybe just bring something different, something nice and plain. All right. And so just ask that. Don't feel bad if they say don't bring that, because again, like I said, if they're in a semi-private room, but even if it's just them, ask first if we're bringing it, because everybody wants to bring flower because they love their family or their friends and all, but just ask first. It's just kind of nice that way. Okay. And if you can bring alternative gifts and all, bring your, you can bring a book, you can bring some other, like I said, pair of slippers, a nice little robe, and things like that. Nothing that's going to affect the IV lines and or like heart monitor, but just ask them, what else do you want to bring? Do you want me to bring you something fun? Maybe like a nice picture, or bring an iPad or something like that. It's just something that would keep them going. But don't feel bad if they tell you don't bring certain things, okay? And also don't bring anything really important, because it may get missing in the hospital, and they tell you that it's something really valuable. Like I used to tell my patients, don't bring the decoration that grandma brought on the ship coming to America with, or something really important, or like nice jewelry. You say, oh, I want her to wear this so she can remember her grandmother or great grandmother. Don't bring that, because when they're moving them around to take EKG, to have a CAT scan, or so many other things that could be going on, it could get misplaced, and you don't want to lose something very valuable and really important to the family. So keep those things, and even if they're coming to the hospital with it, take it home. Okay. And also turn off your cell phone or silence it. Okay. I just say turn it off, because the problem is, like, some people have their cell phone on and the phone's ringing, and then I've seen some people talking. It's like, okay, you're talking too loud. Yeah, some people just like go on just talking. It's like, okay, or like your neighbor, you visiting, and you look and you see the roommate next door, and they're just talking really loud. After a while, they're like, oh, could you just kind of lower down a little bit? And I understand sometimes it's important. Sometimes people are like doing their jobs, or they're on the phone and all that, but just kind of silence it off, and just be courteous of the person next door and the person's family member. Like, look, I'm sorry, I'm just going to step out and get this phone call. Oh, I'm sorry, I'm just going to do this and all that. And people can be understanding, when they come in there, and then also turn it off too when people are talking to you. And also it's important because they're explaining all that information. So just gotta silence it off. And especially when they're talking to the family, from the patient and all, just do that. Most of the hospital staff, they'd be like, oh, okay, I know you have to do that. So go ahead, go answer your phone and do that, and come back real quick. And or just tell the person, okay, I'm talking right now. I'll call you right back. Okay. And again, like I said, if you have to do some jobs, things and all, I've seen some people on the phone and they're talking to the job and they're back and forth. It's like, oh, just you can just step out for a little bit. Okay. So no big deal. But don't vibrate and all. Okay. And some hospitals also, they have like different policies too, so you want to make sure. Some people like to videotape and all. Am I dating myself when I say videotape? Record, you know what I mean. Anyway, so if they tell you, please do not record in here, please do not record, because you could be sitting there and you're recording something else. You're recording, especially if you're recording the staff, you're not allowed to do that. Most hospitals will not allow you to do that. And they'll say, oh, if I don't record, and that means they're probably trying to hide something. No, because somebody could be saying something else that's like, confidential, and that recording could be in your video. Okay, you could be saying something about a patient next door. Nobody wants to hear that, because once you put that on the internet, you're also exposing the other patient, because sometimes some patients don't even want to be in, they tell you to completely, confidential. They're not even in a hospital. You can't even say, oh yes, this patient's here, or that patient's there. No, you can't even do that. So the patient could be going through an abusive situation where they don't want anybody knowing that they're in a hospital. Okay, and you doing that, they could hear that conversation. So it's important. So be mindful of all that. It's not just telling you, oh yes, we're trying to hide something from you, or we're trying to do this to your family member or friends and all that. Just be mindful that there's so many other reasons why people are in the hospital, and there are some confidential reasons. There's some safety issues too, because sometimes children could be in the hospital. Let's say you went to go visit your child, and another child in the hospital, that's a minor, and they're trying to keep that child safe. So be mindful of that when you're doing that. Okay, so It's not always people trying to hide stuff from you. Most of the time, they're not trying to hide anything from you. They'll tell you. And if you have any questions, you can go in your mind chart. Your patient, your family members in the hospital, your mind chart is also available while you're in the hospital, so you can get that information. And then you can come and say, you know what, I have some questions. I need to ask some questions. Can we please go somewhere private and do that? Okay. And other one, keep your visits short. Okay, because sometimes you go in there, that's different. Of course, the situation is different depending on the diagnosis and all that, the patient's condition, the patient's age limit, the patient's roommate, and the time of the day. And also try to be mindful of that when you go visit them. You're like, okay, I'm going to be here. How long do you want me to be here for? And especially if you see them getting tired and all that, and it's like, oh, you don't want to feel bad that you go in and you're leaving and you're sitting there for a while. Oh my God, I went to go visit and she was couldn't wait to get me out. And this, I had a patient before one time when she's like, and the family members were there for the longest time. And by the time they left, I said, oh, everybody left, because there was a lot of family members that came at one time. And she's like, oh my God, I couldn't wait for them to leave. I had had to go poop. It's like, she just like, I said, you could have told them that when they were here. She goes, no, I didn't want to make them upset and all, but I had to go. So yeah, I'm happy that they left, because I gotta go. And sometimes you gotta go, you gotta go. You can be in a hospital and sitting there, you have to go do number one and number two, and so many people around, and it's not okay, I gotta go, let me go in the bathroom. You don't need people around for that. Okay, so just be mindful of that. Just say, I'll be here for a little bit. If you want me to come back, if you want me to stay a little longer, you tell me what it is that you want to do. I know when your family members in the hospital, you want to be there. And especially also, if you want to visit at a certain time, ask them, when do you guys do multidisciplinary rounds? Meaning, when is the attending doctor coming, the main doctor just taking care of your family member, any other consulting doctors like the specialists, let's say if they go in there for lung issues. When is the pulmonologist coming in? That's the lung doctor. When is the cardiologist coming in? So all the doctors are on there. The social workers may come by too, physical therapy, occupational therapy. So everybody comes in all at once. So what time do you do your multidisciplinary rounds? And so I can be here, so that way I can see the whole team at one time and I ask them all the questions. And at the same time, also, like I said, if you need to use your phone for somebody else who could be in another state or somewhere else who couldn't make it, tell them I have a family member on the phone who also wants to listen on to. They can also ask questions. So let them know ahead of time, so it doesn't look like you're recording something. Okay. Again, it's not trying to hide anything from you, but just let them know. It's just common courtesy. Okay. So they're like, oh, this person's on the phone. They can't be here. Can they ask some questions? And they do it that way. And try to find that time too, because that's when everybody's available to ask you the questions. But you can always ask the questions later, but don't do it like at a change of shift, like 7 o'clock. People will call 7 o'clock or 3 o'clock. Oh, how's my mom? Well, the nurses are still getting a report. They're not going to be able to tell you how your mom is, because they have to get a report and then go see the patient, make sure they're fine, and then come back in and call you. So just be mindful. Don't do it right at the change of shift. Okay. And this other one that says, leave the room when the doctor or provider arrives. Not necessarily, because hold back. Just if you're not a family member, like a close family member, a friend, and the provider comes in, the doctor comes in again, like I said, your PA, NP, and other people who come in and they start saying stuff. You must say, okay, you know what? We're not that close and all that too. I'm just gonna step outside for a little bit, because there's certain things that, you don't want your neighbor who came to visit, or even a cousin, or even a sibling, or whatever, your parents, you don't want them coming to hear everything the person's saying. You can always tell them what happened later on, but you don't want everybody hearing your business. Okay. I know I talk about the fact that we need to talk about our family history to family members and friends, but it's important that sometimes, your brother sitting there, he's visiting, and they're going to be talking about something that has to do with your GYN issues. You don't want your brother hearing that. Or sometimes you don't want your father hearing that. I had a patient before, she was 18 years old, and the mother was in there, and I had to like literally mouth the words, any impossibility you could be pregnant, and she's like, oh no, my God. And she, you can see the panic in her face. So you also have to understand the cultural issues to be around that too. So just be mindful of that. If you're not close to the family and the family comes in, the doctors come in and just say, okay, yeah, I'm just gonna step out for a little bit. And it's like, oh, okay, I appreciate that. And when you come back in, the patient say, oh, why did you have to step out? And then you can say, I just wanted to give you your privacy. Okay. So just be mindful of that. All right. And of course, follow all the hospital protocols and all, making sure that when they tell you visiting hours are over, they'll start giving an announcement like 30 minutes ahead of time and all. Okay, so you can say, oh, can I stay? I'm not going to be of any bother, especially if you have young children too. they may want to leave and all, and you may want to take them home. So some people say, yeah, you can stay and wait for a little bit as long as it's not going to be moving away. And depending on if it's ICU, CCU, and places where they don't allow too many visitors and all, just be mindful of that. Okay. Alrighty. So, and let's get to the don'ts now. I'll answer your questions. Let me see here. I see some questions here for a second. So if you're watching now, if you're just joining me, this is Abby Tyler's Healthy Living page. I'm doing do's and don'ts for visiting relatives, okay, and friends in the hospital. Let me see if there's any questions here. I'm gonna come back to it. Okay, let me see. Cover said, good evening, all. Thank you very much for watching. Please share. And he said the same thing there. And oh, Jackie Jackson just shared the show. Good, good, good. Thank you, thank you, thank you. Everybody share the show, share the show. You know, we share everything else. Let's share something educational. Okay, so the next one, let me see. Let me get back to my place here. Don't visit if you might be contagious. Okay, I know sometimes you want to visit and you got a little cold and all that too. So don't do that. Let me just get my thing here. Okay, so when you're visiting, you know, you have, especially again around this time, this flu season, there's so many things going on, and little kids, you know, they have their running nose and all of that. You may have COVID, you may just, sometimes you may just have the symptoms and all that. Try to say, I can visit you now. Again, like I said, wear your mask if you absolutely have to go visit, because there are times when you have to go and see the patient, your family member or friend for a reason. So cover up yourself, but if you find you know you're not feeling well and all that, and again, their immune system is already impaired because they may have had surgery. They may be there for reasons with, you know, the lung and, you know, like I said, the lung issues, asthma, COPD, so many other reasons. And anything that's going to cause them, let's say they're getting ready for surgery, they can't afford to get sick, because if they get sick and all that, they cannot go to surgery. So you don't want to delay that. So just say, you know, I will come, but I can't come right now, but I'll come and I can see you for a short period of time, or maybe we can just FaceTime. So many different ways now to see your family members in the hospital that you don't have to go there and expose them to anything that you know that's going to delay their care. Okay. The other one is, don't bring children. Again, hold back. Don't bring children, especially little kids and all. If you're going to bring them, make sure that they're not going to be asked first. If the patient's in the ICU, CCU, places where children are not allowed to go. Sometimes it's children no longer, you know, 8 and above. Okay, you may be like, well, my kids are much younger. Well, you know, that's the policy. Don't bring them here. Again, they can sit there, they can be on FaceTime, and they can talk and all. Don't bring them. And some people, when they bring their children, they just leave their children, you know, just run around. And many times we had to be like moving around trying to get the children to sit to one place and all that. So don't do that. If you're going to bring your children, bring them with their dolls, bring them with their cars, their iPad or something, just something that's going to keep them nice and quiet, not, you know, subdue them or anything like that. But they also have to be mindful, because the roommates also. We had a patient one time, she had just come from surgery, and the family member came in. Oh my God. And the little one, he was just on the radiator. He had his little car and he was just raking it back and forth, just rake. And the poor lady sitting there, the patient, and she's like, you know, nauseated. And I mean, she just come from surgery like 30 minutes, and they just brought her up. She came from the recovery room and came to us, but she was still like not completely stable yet. And he just raking his car back like 5 minutes into it. And you could tell that she was like so upset. And I finally just said, stop. I'm like, turned to his mother. I'm like, make him stop. Like, no, he's doing that. If you it's like, stop. Can you not tell that she's not? You look at her face, you know, and they're like, oh, I'm sorry, I'm sorry, I'm sorry. So if you bring your kids and all that, especially if they're younger too, they're gonna run around. Their body is not, you know, to where yet they can sit there and just be sitting down for like 5 minutes, 10 minutes. No, they don't have that ability to just sit there yet. So if you're gonna bring them things again, don't bring them with a car that's gonna be raking the radiator, but just bring stuff that's gonna keep them nice and calm, and they can talk to grandma, they can talk to a brother, they can talk to that, but at the same time, make them aware. Tell them before you go into the building, we're going in to go see this person, all that. Please don't run around, and please sit down, because the workers got to do their work also while they're taking care of grandma or grandpa or daddy or mommy and all. Okay. And just tell them that. Most kids gonna like, they'll understand. And don't make the visit long either, because again, like I said, their attention span is not that long. Okay. And the other one, don't bring in food without checking on restrictions. All right, the family member, you'd be like, oh, they could use a nice pampada, I'm bringing a nice pampada cassavali. No, okay, or you're bringing some pasta or stuff like that. It may be something where that's too acidic for the stomach and all, so it may upset their stomach. They can be NPO, meaning nothing by mouth. That's Greek, but in Latin, by the way, sorry. So nothing by mouth because they're going for surgery, or maybe they're trying to rest the gut, or maybe they just came from surgery. So call first ahead of time, say if or maybe they're not able to chew. All right, and maybe they're not allowed to have anything solid or stuff like that, or they have a tube down their throat. So make sure tell them that. Said no, I can't bring that. I had a patient before one that's like, okay, they're on a clear liquid diet, meaning whatever they're drinking, you have to be able to see through the liquid. And he's like, can she have bread? I'm like, no, she can't have bread. It's liquid diet. Oh, and then they kept going. I'm like, it's liquid diet. It's not, and it's not to be funny. It's like some people don't understand exactly what it is. So you have to tell them, no, they cannot have that because based on this. No, they cannot have a drink because it's not thickened enough. They're going to swallow. It's going to go down to the lungs and cause them aspiration pneumonia. That can be very deadly for somebody who's like already impaired, somebody's older, or have other respiratory issues and all that. No, they cannot have that. No, they yes, that's something they used to love eating before, but they cannot have that right now. Okay. So ask first before you bring it. I also have some patients who come and visit. The family member came to visit before, and the family member was like going for surgery a couple of hours later, and then the visitor sitting there eating like a big sandwich, like, "Oh, this is really good. When you're done with your sandwich, when you're done with your surgery, you can have some." This is like, but it's funny. So it's like, I was like, really, you sitting there eating that big burger, and the person's NPO. So, but it's like it's family and all too. But they laughed about it too. So nobody's like real strict and all that. Just be mindful of those things. All right. And the other one, don't visit if your presence, I think I got my stuff here. Don't visit if your presence will cause stress, anxiety. Some people also have family issues, and everybody's got a family dynamics. If you're the person that's going to make them anxious and cause them any kind of anxiety, I know sometimes it's not intentional and all, but be like, you know what? I'm just gonna stay home until they come home, or maybe I'll go another time, or maybe if I just go there, say I just gonna visit you and all that. I brought this, I dropped this off, and all that. I'll talk to you later because if it's causing anxiety, their heart start beating fast and the blood pressure go up, and especially if they're in the recovery period and all, or they go into surgery, or they just they need to rest for a little bit, and there's no reason for that. So if you know that's going to cause a problem, please don't go. You already know that ahead of time. Now, if you go, the person might say, you know what, oh, all these things we be having before, I'm just going to put it behind me now. We can go back to, resume our relationship, our friendship, our everything like that. So thank you for coming. So you can kind of play by ear. You'd be like, oh, okay, I'm glad that you're receptive to my visit, but you kind of know it. You can just kind of play it around, see. All right. And other one, like, don't expect the patient to entertain you. It's like if you're there and you're like, how come you're not talking that much? How come you sitting there? Oh, let's watch TV together. Oh, you see the game, and the person's like, no, I just want to be left alone. It's good, come to visit me, just sit down. Sometimes it's like just your presence alone. You're just sitting there and doing that, and that's fine. You don't need to be talking back and forth. The person appreciates that you're there, but then don't expect them to be doing so much when they're so tired. And sometimes they just want to just lay back and relax. Okay. So all of that, and don't smoke before coming. Also, if you smoke, I've been in a position where people smoke right before coming in, and the whole room just reeked of cigarette smoke. All right, that also can affect the person too, even if that person smokes. All right, still, if they're not smoking in the hospital, so they're just going to become nauseated and all of that. So don't smoke right before coming. And even if you do smoke, okay, fine, spray something in yourself just to kind of take away everything that's going on there. So don't smoke before going, and don't drink. I've also had people who came in before they were drunk as a skunk, and they came in and they just literally just fell asleep. I'm like, and then the person who was drunk was the person that was taking the patient home. Oh my god! And I was like, oh, I said, oh, guess what? The paperwork is not ready yet. So they just fell asleep, and I allowed them to stay there, and they slept the entire time. They woke up, they were well rested, and I said, so sometimes we have our tricks too to keep people safe, because you can't sit there and see somebody who's drunk and taking somebody out. First of all, so that's what you do. All right. So at the end of the show, I didn't want to make it long anyways. So that's the story. So that if you're just joining me, You can go back and watch do and don'ts for visiting patients in the hospital. That also kind of goes along with the nursing home setting, but it's like less acute. So nursing home most places like 24 hours, or like hours vary more than the hospital. So just remember that the most important thing is making sure the person is in the hospital. You love them, you care about them, but you want them to heal up and everything so they can come home and go back to their regular lives. Okay, so that's the most important thing. So you can sit there and say, I'm mad because it said this, it said that. But just remember, the person here, the star of the show, is the patient in the hospital. Okay. And so for all of you who have family members in the hospital right now going through all the different difficulties and everything else, my thoughts and prayers are with you. I wish you all healing. And if I'm here to watch this. Now it's a weekly show again, and I'm Abby's daily dose during the week. So thank you all for watching. If you're watching now, I say thank you. If you're watching later, I say thank you. Also, please share the show. Please share the show. Please share the show. If you share it, if you comment, also the algorithm puts it out there for other people to see. And Facebook kind of like acting up nowadays too. So, but thank you all for watching, and I wish you all a pleasant night. Bye bye now.